All right, good morning, everyone, and thank you for joining us today. My name is Brianna Mosier with the Flint and Genesee Group. We're also live on the Flint and Genesee Chambers Facebook page. If you have been following us on social media recently, you have seen that we have been talking about jobs everywhere. There is a great need to get people back into the workforce, but we know it's not as simple as getting a job and going to work, and there are often a lot of variables that we need to think about behind the scenes, childcare being one of those. I have with me today Annette Sobosinski from the Child Care Network. She's going to be talking about the landscape of childcare during these unprecedented times, as well as some resources that employers might not be aware of through the Child Care Network to help their employees through these issues. So Annette, I'm going to go ahead and hand it over to you to get started.
Great. Thanks so much, Bri. I appreciate both the introduction and being invited to talk with everybody today. So thanks again. And today I'll talk with you a little bit about the landscape of childcare specific to Genesee County, and then also some resources that we have available that employers can either refer their employees to, or they can partner with us on. So first I'll start, people don't necessarily know a lot about the different options there are for childcare. So I'll start talking about different types of childcare options that there are for people to choose. So first is what people most typically think of as a childcare setting, a licensed childcare center, which this picture kind of demonstrates. These are what people think of like Happy Elephant, or like at U of M Flint, the Early Childhood Development Center. People typically think of these settings when they think of childcare. So it's a facility that's not in a home, licensed to care for one or more children. Sometimes they have multiple rooms. Families choose this kind of care because they like structure, they like the classroom environment. Oftentimes when people use the word preschool, they're referencing a child care center like this. So this is one type of care. Another type of licensed care is licensed group childcare homes. So this is when somebody gets licensed to provide childcare in their own home, and they can provide care for up to 12 children at a time. So sometimes families choose this type of care because they like the smaller environment. It's more like a family home. There's fewer children in it. There's usually one consistent caregiver. It's the owner and maybe an assistant or two assistants that are there on a regular basis. And oftentimes these programs have more flexible hours for families who need, second shift care or extended day care or things like that. And they're often less expensive as well. The next type of care is a licensed family child care home, and it's similar to a licensed group home in that it's out of somebody's home. But these licenses, providers can only care for up to 6 children, but people choose these types of providers for the same reasons as they choose a group home provider. Oftentimes when families can't find infant and toddler care at child care centers, they'll be able to find a spot for their infant or toddler at a family home provider. So this is a really important form of care as well. Next is something called License Exempt. Families in Michigan can qualify for something called a Child Development and Care Subsidy. It's public assistance to help them pay for the cost of care. And they can choose to use that subsidy with this type of provider called a license exempt. So it's an adult who is, sometimes grandma, aunt, uncle, whoever, who gets approved, goes through a process to become approved as a license exempt provider so they can accept payments from the CDC or Child Development and Care Subsidy Program. So again, lots of families choose this kind of care just because they're more familiar with the person. They're more comfortable choosing somebody they know to care for their young children. So this is a really high number of providers in Flint and Genesee County that are available to provide this type of care. Family, friend, and neighbor care is similar to license exempt care, only it's not a formalized relationship. So these people are, providing care, but they're not getting paid from the state through the CDC subsidy program. But they may be a relative who's just caring for the children of their relative. And I always like to make sure people are aware that there is a legal childcare out there as well. So you can see here, it's illegal in the state to earn more than $600 a year for longer than 6 weeks at a time, providing childcare services to children unrelated to the provider. So this type of care comes up often too. People do it because they don't know that it's illegal. They don't understand the regulations around licensing, or because they can't get licensed. There's zoning laws, or they don't have the right type of space to become licensed. They can't afford the costs associated with becoming licensed. And sometimes people choose to operate illegally so that they don't have to comply with regulations. So, but this is also another form of care that we, like to mention. So specific to Genesee County, I have some data to share about what's available, about the numbers that are available. So of the type of providers that I shared today, we have 181 licensed child care center programs in Genesee County. We have 54 licensed group child care homes. We have 60 licensed family child care homes. And you can see where I was talking about a lot of people choose family, friend, and neighbor providers. We have 253 licensed exempt providers. There's really no way to estimate the informal family, friend, and neighbor providers and the illegal providers. We don't really have any way of knowing the numbers of those in Genesee County. In terms of what this means for the capacity for the number of children, so for the licensed child care centers, those 181 that I spoke about, they could have the capacity to take up to 14,372 children. Now, I'm going to a note about capacity. Just because a program is licensed to provide a certain number of spots does not mean that they have that many spots available for children. So, for example, during the pandemic, many programs had to reduce the number of children they accepted, either because staffing was an issue for them or because of regulations that they had to put in place in terms of how many children were in a classroom, things like that. So just because they're licensed to provide, for example, one program, maybe they're licensed to provide 100 spots for children, maybe they're only providing 50. So this number, it tells you what's possible, but not necessarily tells you what is reality at this point in time. As you can see, the licensed group homes, they have the capacity for 644 children, family homes for 360, and we don't really know a way to estimate the number of people that licensed exempt providers are caring for. So this total number that is possible is 15,000, a little over 15,000. And just a note about that too, in Genesee County in 2019, according to Kids Count data, there were 83,782 kids birthed to age 12. But even if we only think of kids who are birthed to age 4 who are in need of full day care, there were 23,786 in 2019. So you can see that there are way more children than there are spots available in licensed programs. So, also there's been a decrease in licensed childcare options over the past decade or so. The overall number decreased by 2.5% between 2010 and 2017. And the number of slots are decreasing as well. So by quite large numbers. So if employers are hearing from their employees that childcare, lack of access to childcare is a barrier for them, these are some of the reasons why. So some other childcare industry issues. One of these is cost. In Genesee County, the average cost of childcare across all different types of providers across all different ages is a little over $8,000. So that's just one child. So if you think about that number, center childcare is a little bit more expensive. Care for infants is more expensive. So that's just an average number. And then in 2019, the median household income in Genesee County was $48,588. So that means that half of all households earned less than that. But even with those numbers, for households at that level, care for one child equals 17% of their household income. Now, the Department of Health and Human Services recommends that families spend no more than 7% of their income on childcare. So already this number is above that, but when you think about all of the families in Genesee County who earn below that number, they're spending much higher percentages of their income on childcare. So that's one of the challenges. And then for providers, they have many challenges as well. So there are licensing rules about how many staff they need to have for how many children. And for younger children, there's more staff needed. So it means that programs for infants and toddlers are more expensive for them to run due to staffing costs and meeting those requirements. The childcare world requires high credentials. It requires for people to have, at minimum, something called a Child Development Associate credential. It doesn't require this, but in order to be able to provide high quality care according to the state system, you need these credentials, a bachelor's degree in early childhood, but yet at the same time, it's requiring these higher level credentials. It's paying low wages, very low wages. Oftentimes, people working in childcare qualify for public benefits because they don't earn enough to be able to make ends meet in their own families. So, and then these things were already an issue before the pandemic, but the pandemic really, really highlighted what a challenge these things are. And some programs have closed as a result of the pandemic and having to address some of these issues. So now I think Bree is going to share a short video, that kind of explains this topic.
Alicia and Craig needed an early care and education program for their 2-year-old son, Jaden. Eventually, they found a suitable childcare center nearby that offers a nurturing environment for Jaden and is open while they're at work. But it costs nearly $10,000 per year. That's more than a mortgage in most states. Even though they're paying the average price for childcare, it's a financial burden, and now they're expecting a second child. Meanwhile, Jaden's teacher, Sonia, is worrying about how to put food on her own table. Even though she has a bachelor's degree, she earns less than $15 an hour. In fact, more than half of childcare workers and nearly half of preschool and kindergarten teachers reside in families that utilize public assistance. Childcare is complex work that can impact children throughout their lives. Yet Sonia, like many early educators, doesn't receive benefits like health insurance and paid leave. So why do early childhood teachers earn so little when parents pay so much for childcare? There's a flaw in the system. Parent fees alone are not enough to fund quality early education. Let's look at the facts. Parents pay an average of $10,000 annually for center-based care. In certain locations, and depending on the age of the child, the average cost for licensed childcare is even higher. Let's take a closer look at Jaden's childcare center. He's one of 40 children attending full-time. Family payments equal $400,000 a year. About 12% goes to rent, utilities, and maintenance. 23% goes for classroom materials, food, and administrative costs. This leaves about $260,000 for personnel. Early care and education is labor-intensive and requires low adult-to-child ratios to ensure quality interactions. Jaden's Center, open 10 hours a day with 40 children and 3 classrooms, needs at least 3 lead teachers, 6 assistant teachers, and 1 director. The remaining money doesn't allow for median salaries, let alone benefits. Parents can't afford to pay. Teachers can't afford to stay. Public investment is the way. We invest in education for older children. Why not for all children? Here's how we can advocate for more public investment in early education programs. Invest in early care and education as other industrialized nations do. If parents are charged, ensure no family pays more than 7% of their income on childcare. Ensure that all teachers have better compensation and workplace support. Those caring for our youngest should at least be paid on par with kindergarten teachers. Question your legislators and candidates about their response to these issues. So let's invest in our teachers and children. Together, we can make it right for children, their families, and their teachers.
Okay, so that video does a really good description of, why this is. Why does childcare cost so much, but providers are making so little? And it's really because the system is broken. Um, so, um, so that's the story that's kind of the landscape of childcare in Genesee County. And now I can turn to telling you a little bit about Childcare Network, our organization, and what we do and how we work to support children, families, and providers, and how employers can work with us to support their employees who are in need of childcare or support with childcare. So, our mission is to promote the success of children, families, and our community through quality childcare education, advocacy, and family support. We currently serve 7 counties, and starting October 1, we're adding a county to the service area, which is Branch County. So you can see Branch, Genesee, Hillsdale, Jackson, Lenawee, Livingston, Monroe, and Washtenaw County. We've been around since 1971, so we're actually in the midst of our 50th anniversary this year. So we have lots of experience in the childcare world. So essentially, we like to say, what does our mission mean that we do? We help families to find childcare that meets their needs. We help families to pay for childcare. And we help childcare professionals provide quality care to the children and the families that they're serving. So we have several programs by which we serve children, families, and providers. So I'll go through those a little bit, each one. So we are the Great Start to Quality Southeast Resource Center. Great Start to Quality is the state's database of all licensed programs. So it is the database by which families can go to the website, greatstarttoquality.org, and they can search and find childcare. They can search by location, they can search by type of provider, there's lots of different, they can search if their child has special needs for providers that work with kids with special needs. That is the state system, and we use that system to help support children and families with finding parents with finding care, excuse me. We also work to help support providers with improving the quality of care they're providing. So currently we are the resource center and we serve Genesee County. There's been some changes in regions. And so starting October 1st, we will be partnering with a different resource center who will be serving Genesee County, and we'll continue to serve the other 6 counties that we serve, and also Branch County as well. So what the Great Start to Quality resource centers do, though, is really support providers with providing quality care. They do this through providing trainings, through providing consultation for providers, and really helping them to learn more about the best way to provide care for best practices in providing care for children. So. We also are a My Bridges community partner. This means that all of our staff are trained as navigation and able to do referrals. For those of you unfamiliar, My Bridges is the state system by which people can apply for public benefits, including food assistance, cash assistance, and that child development and care subsidy that helps families pay for childcare. So our staff works with families who need help going through the process of applying for benefits. And when there's not a pandemic going on in our offices, in each of our offices, we have a computer where families can come in and use the computer to apply for benefits and get assistance. Our family support program is a program by which we help families pay for childcare. So we serve families who earn up to 250% of the federal poverty level. And if they apply for our assistance, we can help to provide childcare tuition scholarships to help cover the cost of care. So I'll just make a note at this point about the child development and care subsidy that I referenced earlier. That is federal funding that comes through the state to help families afford the cost of care. But the eligibility, in order to be eligible to receive child care subsidy, the child development and care subsidy, you have to be earning only up to 150% of the federal poverty level, which is a very low number. So our program comes in for those families who qualify for the subsidy, but the subsidy payments are not enough to cover the full cost of care, or for those families who earn just above income and they can't qualify for the state subsidy, but they still can't afford the cost of care. So families who receive these child care tuition scholarships are able to get their kids connected with a reliable and safe form of care, which means that they're better able to maintain good work attendance. Sometimes they get promotions. Sometimes they're able to pursue career or other educational opportunities. So it really benefits it benefits the child who has access to high quality care, the family who is able to achieve more financial stability, the child care provider who has a family who is able to cover the cost of care, and businesses who employ the parents, who now the parent is able to, stay consistently at work because they have a reliable form of care. So it's a program that has multiple touches on our systems. Oops, I went backwards, sorry. In Genesee County, we have something called a Family, Friend, and Neighbor Engagement Program. Earlier, you heard me talk about the two different types of providers, the licensed exempt providers and the informal family, friend, and neighbor care. Well, because so many people in Flint choose these forms of care, we want to make sure that a child, no matter where they're at, whether they're at a center or they're with a family, friend, and neighbor provider, that they're having a quality experience. So we also provide support to this group of providers, helping to give them training, give them resources to use with children, and connecting them to resources in the community as well. So we have an early childhood talent pipeline. One of the things, jobs, right? That was one of the things that Bree said at the beginning of this call. Well, just as all employers have been having challenges finding and retaining good staff, early childhood programs have as well. So childcare programs struggle to find and retain highly qualified staff. So we have a program called the Early Childhood Talent Pipeline, where we can work with people who are already in the field and need to get credentialed or need to get some higher education. Or we also work to recruit people into the field so that we have more of a pipeline of talented and credentialed staff that are available to work in these programs. So that programs can open to their full capacity, right, and serve more children. That's the ultimate goal. So we have an early childhood coach, talent coach, who works with people to help them get credentialed or higher education degrees. We are a training agency as well. So we offer lots of different trainings, as well as, right now during the pandemic, 2 conferences. One is called the Building on Behalf of Children Conference. And then we also offer a home provider conference that's just specific to the needs of home providers. But even the Building on Behalf of Children conference, it's something that is, great for parents to attend. Anybody who has young children, there's lots of topics focused on childhood development, trauma, health and safety, all of these things that are really important for anybody who's caring for young children to know about. So those are some of the programs that we offer at Child Care Network. And so now there's a few ways that as businesses can work with us or in support of their employees who need to access childcare options and to have barriers reduced for them. So they can offer childcare benefits. Some businesses offer stipends for people to help them afford the cost of care. They can offer options like flexibility, remote work, sometimes work from home, or different things like that will support employees. There's lots of different ways that employers can support that. Businesses can advocate for more public investment in childcare. Right now, our family support program, the one that provides childcare tuition scholarships, exists because there's a need. There's a need because there's not there's not as high of a public investment in childcare as there should be. And this is really a bipartisan issue. People on both sides of the aisle agree that for us to have a successful, society and communities, we really need for there to be higher investment in childcare so that parents can work, businesses can function, all of these things can come true. So really advocating with policymakers for increased investment in childcare is a really important way that businesses can support their employees. Partnering with childcare providers. We've facilitated relationships sometimes with businesses where a business will have a local private provider that is close to their business location, and maybe they'll pay the childcare provider a stipend to save some spots specifically for their employees' children. It's much easier for providers to operate if they know they have a guaranteed, guaranteed source of income. And then last, but not least, maybe this should be first, I don't know, refer your employees to us for support and or partner with us. There is one more thing that I should mention in here too, is that there is a pilot program in the state of Michigan right now called the Tri-Share Pilot Program. And it's being piloted in 3 other counties in Michigan. But we'd love if they expand for us to be able to offer it in Genesee County too. And it's really a situation where an employer and the state and the parent all partner together, and each of those pays a third of the cost of care. So the employer pays a third of the cost, the state pays a third of the cost, and the family pays a third of the cost. So if this ever does come to Genesee County, businesses could support their employees by agreeing to participate in this Tri-Share childcare project. So I think that is all that I have right now. So I will open it up for any questions that may have come in or that Bree may have.
Annette, thank you so much for sharing all of that information. Some of it was very disturbing when you look at the numbers and you look at the barrier that this is going to continue to be unless we do something different. We'll get to that in just a minute. You guys are doing great work. So thank you for sharing this information, for bringing it to our audience, our employers. I feel like so many employers just have no idea, and they feel like if I can't offer a stipend or if I don't have on-site childcare, which I know some like very large-scale employers offer, they just kind of feel like their hands are tied. So again, can you just reiterate, if I'm an employer and I'm hearing from my team that this is a barrier for them, what else can I do? It is just as easy as referring them to you guys.
Yeah, it is really. Or even, I think you can definitely refer them to us, but you can also, as an employer, come and have a conversation with us and talk through the issue and say, okay, I have this many employees that are having this issue. What are some options that I have for maybe how to support these employees so that childcare is no longer a barrier and I'm able to retain the employees long term. I don't have to worry about turnover as much because employees stay with me because they know I support them accessing high quality childcare.
Mm-hmm, absolutely. And you guys mentioned some of the great training programs that you have available. I feel like you just need to add something that's along the lines of I just had a kid 101, because I had no clue before having a child what it was like to find childcare for my kids. And I remember walking into a facility. I was pregnant at the time. And as soon as she saw me, she was like, you are way too late to the game. Like, we are on a 3-month wait list for the infant room. And I was going back to work in, I hadn't even left work yet. So I would have been going back to work in 8 weeks or so. And there was just nowhere for me to go. Right. And in the numbers you shared, so again, just a quick estimate, Genesee County, there are about 23,000 children of the ages, infant to 4 who need that full-time care. They're not in school, but only 15,000 spots of licensed child care available. So how or what can we as a community, as employer advocates do to help close that gap?
Well, again, I think really advocating for increased investment in childcare, because, one of the reasons why programs are closed, and when I showed that stat about the decline in childcare programs that are opening, is it's just too challenging. When you are a business owner and running a business, but yet you and your staff qualify for public assistance, in a weird way, it's as though childcare is already subsidized, but in the wrong way, right? It's subsidized on the back end, where employees and employers are having to apply for public benefits because they can't afford to live without those public benefits. So that's taxpayer money going to pay for those benefits, why don't instead we invest in the system on the front end in the childcare system so that more business can, and because people are in the field because they love children and they want to provide care for children. But if they can't afford to buy groceries or pay their rent, they cannot do it long term, right? So if businesses jump on board with, advocating for there to be more public investment in childcare, more businesses will open, more spots will be available for children. The whole system will benefit from it. And all communities and employers will benefit from having a workforce that is stable. So.
Yeah, absolutely. And I love that you gave the example of, you're hiring an employee, you're helping them find these benefits. They're able to stay long term. You're able to retain your staff. They then advance within your company. And now you went from maybe having a entry level employee to a manager or supervisor down the road. So the benefits are there. It's just helping get people over this hump to find the resources that are available so that they can get back to work. Right. And, you said it, like, these centers are doing amazing things. I am forever thankful for the early childhood education teachers that we had, Miss Becky, Miss Jan. They're like family to us. And right. It's as an employee, from an employee standpoint, childcare is really what helped me be my best self at work, because I knew I didn't have to worry about my kids when I was here, but then also be my best self at home, because this last year, all of us parents who worked from home, had our kids at home, it is a very difficult thing to work through. And, a lot of people are still in that position, because you mentioned some of the child care centers had to close because of COVID. So again, I just want you to mention that resource for those centers that have closed, those employees who still might be out there looking for a job. Can you mention that talent pipeline one more time?
Yeah, the early childhood talent pipeline. Yeah, we have a staff member who is solely dedicated to supporting people who are in early childhood to get connected and get credentialed so they can get higher paying jobs and move forward in their careers and early childhood professionals, and also trying to recruit more people to the field, right? That's the dual focus of that work, essentially, is to build this pipeline so that we have enough staff in Genesee County to support the childcare that is needed. So
yeah. And if you are an early child care professional in Genesee County, again, thank you so much for everything that you do. We talked about jobs at the beginning, and the Flint Genesee Group is hosting a career expo tomorrow at Dort Financial Event Center. That's going to be from 1 to 5. And we do have several child care facilities on the list. So if you are maybe out of a job because your center closed during COVID, there are other centers that need you, and we want to help match you with those. So you've got the early childhood talent pipeline through the Child Care Network, and then again, several facilities that'll be on site tomorrow from 1 to 5 who would love to talk to you. I don't see any questions coming in, but again, Annette, thank you so much for the information. Anything else you want to share as we close?
Yeah, I did want to add one more thing. You heard me talking about advocacy. That's really important. And advocacy is in our mission as well. So if people think, oh gosh, I didn't realize what an important issue this is, and they're interested in advocating or learning more about advocating, they can also contact me or contact us at Child Care Network, and we can support them in their advocacy journey.
Amazing. All right. Great information on what you can do for advocacy, what you can do as an employer for your employees, and then how we can come together as a community to kind of help close the gap and eliminate the barrier of childhood care and getting back to work. So Annette, again, thank you so much for joining us. You shared with me a flyer that I will be sure to post on our website along with the recording of this session. If you are in need of anything, Annette, I can't remember, is your contact information on there for people to reach out to you, or will it refer them directly to the child?
On the flyer, it'll refer to the Child Care Network and the individual staff members for the programs. At the end of my the presentation I used today, if you post that as well, there's a contact information. The last slide has my contact information individually. So.
Okay, perfect. I'll be sure to share those slides as well.
Okay, great.
All right. Well, that about wraps it up. Thank you for joining us today. We will see you next time.
Thank you.